Good evening, dear friends. So today we are going to discuss about few aspects of diabetes management. Diabetes management, if we follow a simple rule of ABCD, it will help us a lot to prevent diabetes related complications. So what is this simple ABCDEF? ABCDEF means starting with A, that is A1C, HbA1c. So we all know the target, and the target HbA1c should be less than 7% for almost all patients, and in some subgroup where there is very less chance of hypoglycemia and the patients are on some drugs which are not have probability to cause hypoglycemia, like non-sulfonylurea based therapies like DPP4 inhibitors, pioglitazone, metformin, or SGLT2 inhibitor, we can try to achieve HbA1c less than 6.5%. So target should be less than 7 at least, and in some setting we should try for less than 6.5%. Yes, there are a group where the life expectancy is not much. The patient may suffer from cancer with very bad prognosis, and also like in case where there is chronic kidney disease or any other cause where tighter glycemic control, that means less than 7%, may potentiate the risk of hypoglycemia, we can relax the target of HbA1c and it could be set between 7 to 8% in those patients. But for all practical purpose, if my HbA1c is more than 7, then it is not at all desirable. And in some setting, we should try to achieve HbA1c less than 6.5%. Next is B for blood pressure control. And again, as per the American Diabetes Association, they suggest to bring down blood pressure less than 140 by 90 millimeter of mercury for all diabetes patients. So blood pressure control is again very important. And if we go by the ACC/AHA guideline 2017, then we will found the cutoff blood pressure that should be below 130 by 80 millimeter of mercury. So at least we need to be in the range below 140 by 90 millimeter of mercury, and in the setting where we can reach the goal less than 130 by 80 millimeter of mercury without causing any harm to the patient, then we should try for that. Apart from that, while we are talking about blood pressure, there are some other aspects, like blood pressure does not only mean the office blood pressure. Now it is well known that even we should go for ambulatory blood pressure monitoring, because there are some metrics of ambulatory blood pressure monitoring, like whether there is nocturnal hypertension, whether the early morning BP surge is very high, or whether the patient does not follow the rule of normal dipping pattern while he is sleeping. So this need to be addressed. And there was a dictum like that when we are talking about home blood pressure monitoring, then at least morning blood pressure should be below 135 by 85 millimeter of mercury or 135 by 80 millimeter of mercury. And nighttime blood pressure, that means when we are checking blood pressure after 9 p.m., it should be below 120 by 70 millimeter of mercury. So these cutoffs are important. And if I am a diabetic patient, I should know about this target, and my prescriber, my physician, it is important to let them know my blood pressure, home blood pressure. According to that, physician, my treating physician, can take the apt decision to titrate my antihypertensive therapy. Next is C, that means the cholesterol. Again, there are different metrics of cholesterol, but most importantly, we should check the LDL cholesterol first, and that LDL cholesterol, that should be below 100 milligram per dl, and in some subsetting it should be below 70 milligram per dl. And when we are talking about secondary prevention, that means some events already happened to me, like one AMI or maybe a ischemic CVA. So in that case, we need to reach the target LDL as low as less than 55 milligram per dl. So these targets are very important. But one thing is more important, that we often, when we are a diabetes patient, we often think that why I will take a cholesterol lowering drug. I don't have cholesterol. So it is very important to know that if I am diabetic and my age is more than 40 years, so it is very important to take the cholesterol lowering drug. What should be the dose of the cholesterol lowering drug? That depends on different factors, like whether I have a high risk for cardiovascular disease or low to medium risk of cardiovascular disease. According to that, our physician will titrate the dose of cholesterol lowering drug, that means statin. So we should be very focused, and we should not forget to take our cholesterol lowering drug. Next is another important lipid parameter apart from cholesterol, that is triglyceride. Generally, when the triglyceride is below 500, first of all, we should target our therapy to lower the LDL cholesterol. Then we need to check after LDL cholesterol lowering with optimum dose of statin. If we not reach the triglyceride level after dietary modifications below 203 milligram per dl, then we need to think about some drugs which can also lower the triglyceride level. And for that, there are some drugs like fenofibrate, omega-3 fatty acids, and also Indian drug we know, seroglitazar. But in case where the triglyceride value is more than 500, in that case, we should initiate triglyceride lowering therapy from the beginning. Why? Because hypertriglyceridemia, that means triglyceride value more than 500, that can cause pancreatitis. So you should start triglyceride lowering therapy if the triglyceride more than 500 without wasting time. And as we are talking about diabetes, diabetes means there is some metabolic disease, and that it is a metabolic disease. Diabetes is a type 2 diabetes is a metabolic disease. So we have a metabolic disease associated fatty liver, and there a lot of patients come to us with deranged SGPT SGOT level. In that case also, that saroclitazar works to lower the SGPT SGOT level to give some benefit. Next is, after A, B, C, we should have a D. D means diet. The diet should be very much focused, and we should follow our dietitian advice. Calorie restriction is important, quantity is important, but again, the quality of diet also need to be improved. There are lots of studies now going on, different aspects of diet, which oil is better, which type of protein is important, which type of fat is important, how much is important. There are lots of evidences now coming up for plant-based diet, and how plant-based diet, that means the quality plant-based diet helps our good gut microbiota to grow, and therefore helping our system to prevent atrocities related to diabetes. So D for diet is important. Next is E. E means exercise, and this exercise means we should have a planned structured exercise program, at least 30 minutes per day. Brisk walking is important. Brisk walking means 3 to 6 kilometers per hour. That should be the speed, and with that speed we should have a 30 minutes brisk walking. Along with that, at least thrice weekly we should have a muscle strengthening exercises, that means resistance training. Apart from that, there are lots of evidences are now growing for yoga, how yoga is important, and we all know world is celebrating International Yoga Day 21st of June every year. So there are lots of scientific evidences for yoga, how they can prevent metabolic disease related atrocities. So we should promote yoga. And next is, after this E, next is F, and F means here the follow-up reconciliation. That means when I am having diabetes, it is my duty to have a follow-up. We should do some specific test to see whether there is some nephropathy, that means kidney related issues happening, complications arising, or there could be a retinopathy. So E for, again, another important thing is eye examination. So we should at least check our retina every year, and if there is some issue, we should have a follow-up to the ophthalmologist more frequently, but once yearly retina checkup is mandatory. Next, the follow-up reconciliation means if I am a diabetes patient, that does not mean I don't have any other orthopedic issue or gastroenterological issue. So I could have those. So when I am taking multiple drugs, there could be possibility of different drug-drug interactions. So it is our duty to go to my treating physician to ask them all those drugs I am taking, whether there is some issue of taking different drugs, whether there is a possibility of drug-related harm. And we should all remember there was an extensive epidemiological study conducted in USA which suggested drug-induced death is second most common cause of death in US after accident, motor vehicle accident. So we need to acknowledge drug-induced disorders and drug-induced death. And for that, this follow-up reconciliation is very important. Next is G. G for I always believe that G means glucagon. And this glucagon, always believe that glucagon centricity is very important while we are managing our type 2 diabetes patient. We always talk about insulin. Yes, insulin is important, but diabetes is such a disease where we should also take care of our glucagon status. Because if we could not target this hyperglucagonemia, then the metabolic complications will go on and on. So there are some therapeutics which can target glucagon, like DPP-4 inhibitors, like GLP-1 receptor and agonist. So we should try that. And I always like the cartoon Tom and Jerry, and I always use this example to emphasize the importance of glucagon in diabetes pathology. That is, we talked about insulin cat and metabolic mice. Yes, for diabetes management, insulin cat is important to bring down or to control those metabolic mice. That means the Jerry, metabolic mice is Jerry, and tomcat is insulin. So tomcat can control the Jerry, metabolic mice. But if the Spike is there, that means Spike is that dog in the Tom and Jerry cartoon who always help those who always help Jerry, and that Jerry means that metabolic mice. So glucagon is there to help our metabolic mice, and for that we need to control glucagon. We need to control Spike dog so that the insulin cat or insulin Tom can do his work. So glucagon is important, and when we are taking care of our diabetic patient, we should not forget that. So as we talked about G, then after G it is H, and here H means the hypoglycemia. So when we are talking about diabetic patient, the hypoglycemia is a very often complications we face. We need to aware our patient regarding that hypoglycemia, what should be done during hypoglycemia, how they know that they are going to be hypoglycemic, what are the steps that should be followed by them to prevent hypoglycemia. These are very important issues. Next, after H, it should be I, and I means here, yes, the most important thing we all often forget, that insulin. And another I, that means inertia to insulin, we need to overcome. When there is right patient, we should not delay the initiation of insulin. So that is most important, and we should always remember that. So like this, I think it is over time that was allotted to me. So I hope we all should follow a simple mantra to have a good diabetic life. That is, we should control our ABC, HbA1c, blood pressure, and bad cholesterol, that is LDL cholesterol level. And also we need to be happy. We should have a good sleep, and we should eat properly. Thank you. Thank you very much for giving me this opportunity. Wish you all a happy diabetic life, and also wish you all can treat the diabetic patient well.